10. Pathognomonic signs and symptoms. Gower's sign.
The sign describes a patient that has to use their hands and arms to walk up their own body from a squatting position due to lack of hip and thigh muscle strength. Indicates weakness of the proximal muscles.
Duchenne's muscular dystrophy.
Chvostek sign.
When the facial nerve is tapped, the facial muscles on the same side of the face will contract.
Trousseau's sign.
Involuntary contraction of the muscles in the hand and wrist that occurs after the compression of the upper arm with a blood pressure cuff.
Hypocalcemia.
Rhizus sardonicus.
Facial expression characterized by raised eyebrows and grinning distortion of the face resulting from spasm of facial muscles.
Tetanus.
Leonine facies.
A face that resembles that of a lion with prominent convexities, furrowed creases, thickening of facial skin, loss of eyebrows and eyelashes.
Leprosy. Moon face.
Moon face is when fat deposits build up along the sides of your face, causing severe swelling. The swelling can make your face look round and puffy.
Cushing syndrome. Levine's sign.
Many patients with chest pain made this same sign to describe their symptoms. Clenched fist held over the chest to describe ischemic chest pain.
Angina pectoris. Oculomasticatory myarrhythmia.
Smooth, continuous, slow, pendular, convergent divergent nystagmus, concurrent contractions of the masticatory muscles, supranuclear vertical gaze palsy, and occasionally rhythmic movements of the limbs.
Whipple's disease. Bilateral internuclear ophthalmoplegia.
Ocular movement disorder caused by a lesion of the medial longitudinal fasciculus. It is characterized by impaired adduction of the ipsilateral eye with nystagmus of the abducting eye.
Multiple sclerosis. Pericardial friction rub.
Extra heart sound of to and fro character, typically with 3 components, 2 systolic and 1 diastolic. It resembles the sound of squeaky leather and often is described as grating, scratching, or rasping.
Pericarditis. Pseudomembranes on tonsils.
The symptoms usually begin 2 to 7 days after infection. They include fever, chills, fatigue, bluish skin coloration, sore throat, hoarseness, cough, headache, difficulty swallowing, painful swallowing, difficulty breathing, rapid breathing, foul smelling and blood-stained nasal discharge, and swollen neck. Within 2 to 3 days, it may destroy healthy tissues in the respiratory system. The dead tissue forms a thick, gray coating that can build up in the throat or nose. This thick gray coating is called a pseudomembrane. It can cover tissues in the nose, tonsils, voice box, and throat, making it very hard to breathe and swallow. About 40 to 50% of those left untreated can die. It is preventable through vaccination.
Diphtheria.